Hallucinations are false sensory perceptions that occur without any external stimulus. They feel completely real to the person experiencing them, but there is no corresponding object, sound, smell, taste, or touch in the environment. Unlike illusions, misinterpretations of real stimuli, hallucinations are generated internally by the brain. They can affect any of the five senses and range from mild and fleeting to intense and distressing. They are a symptom, not a specific disease, and can occur in many conditions or even in healthy people under certain circumstances. Types of hallucinations. Auditory, most common. Hearing voices, music, sounds, or commands that aren't there. Voices may comment, criticize, or instruct. Visual, seeing people, objects, lights, shapes, or scenes that don't exist. Tactile, feeling sensations like bugs crawling on the skin, being touched, or internal movements. Olfactory, smelling odors, often unpleasant with no source. Gustatory, tasting something, e.g., metallic or bitter, without eating or drinking. Mixed types can occur. In psychiatric conditions, people may lack insight that the experience is unreal. In other cases, they may recognize it as a hallucination. Causes and brain mechanisms. Hallucinations result from disruptions in how the brain processes sensory information, often involving abnormal activity in sensory cortices, neurotransmitter imbalances, e.g., dopamine, serotonin, or issues with reality monitoring and predictive processing, the brain's way of combining internal predictions with external input. Common causes include psychiatric disorders, schizophrenia, very common, bipolar disorder with psychosis, severe depression with psychotic features, schizotypal personality disorder, neurological conditions, epilepsy, especially temporal lobe, brain tumors, stroke, dementia, Alzheimer's, Lewy body, Parkinson's disease, migraines. Substances, alcohol or drug intoxication withdrawal, e.g., hallucinogens, stimulants, alcohol delirium tremens, certain medications. Other medical issues, severe infections, high fever, metabolic imbalances, e.g., low blood sugar, electrolyte issues, sleep deprivation, sensory deprivation, e.g., vision, hearing loss, Charles Bonnet syndrome, extreme stress or trauma. Normal experiences, occasional mild hallucinations can happen in bereavement, sensing a deceased loved one, extreme fatigue or hypnagogic, hypnopompic states, falling asleep, waking up. In the brain, auditory hallucinations often involve overactivity in language and auditory areas, e.g., temporal lobe, Broca's, Wernicke's areas. Visual ones engage visual cortex. Neuroimaging shows involvement of networks including prefrontal cortex, insula, hippocampus, and altered connectivity. Diagnosis: thorough medical and psychiatric history plus neurological exam. Imaging, MRI or CT to rule out tumors, stroke, etc. EEG for seizure activity. Blood tests for infections, metabolic issues, toxins, or nutritional deficiencies. Psychological evaluation to assess mental health conditions. Prompt medical help is important, especially if new onset, distressing, or accompanied by confusion, seizures, headaches, or other neurological symptoms. Treatment. Treatment targets the underlying cause rather than the hallucination itself. Medications, antipsychotics, e.g., for schizophrenia or psychosis, to modulate dopamine, anti-seizure drugs, antibiotics for infections, adjusting or stopping causative medications. Therapy, cognitive behavioral therapy, CBT for psychosis, coping strategies, or addressing trauma. Other interventions, treating sleep issues, substance cessation programs, surgery for tumors, or stimulation techniques, e.g., TDCS in some cases in research settings. Supportive care, reducing stress, ensuring safety, family education. Many people recover well or manage symptoms effectively once the root cause is addressed. Prognosis depends heavily on the underlying condition. Excellent for reversible causes, e.g., fever, medication side effect, and more chronic management for conditions like schizophrenia. This is general educational information, not medical advice. If you or someone you know is experiencing hallucinations, seek prompt evaluation from a doctor, psychiatrist, or emergency services, especially if there's risk of harm. Early intervention improves outcomes significantly. Related to previous topics,